I believe we have Ms. Karen Tully on the line. Ma'am, you have 3.5 minutes for your testimony. You may begin.
Good afternoon, members of the committee. Thank you for allowing my testimony. My name is Karen Tully. I live in North Situate, and I support the Lila, Manfield, Sapinsley Compassionate Care Act, Senate Bill 775. My mother, Sandra, had battled pancreatic cancer for 3 years, and I know when my mother would have taken the medication if this law was in effect. Not at her 6-month diagnosis, not even at a 3-month diagnosis, because people fight for their life until the very end. It was 3 weeks before her death, and I will never get the picture out of my mind of her in the hospital bed crying while she said to me, "I just want to die." It broke my heart knowing how helpless she felt. But instead of taking a medication and going to sleep, she went to hospice. She was not able to eat anymore or leave the bed, so her body and mind started to deteriorate until she was not able to communicate anymore and would scream out in pain whenever she was moved. And I would help the nurses, and I'll never forget a few days before she died, I tilted her sideways and held her in my arms so the nurses could clean her. And she screamed in my ear the entire time. And while she screamed, I looked down at her body and I saw what I'd only seen before in pictures of the Holocaust. Her deathly thin body riddled with bruises on her paper-thin skin as she screamed in my ear and tears ran down her eyes. When the nurse was done, I gently put her down and I carefully peeled my hands off her back because I was afraid her skin might come off with my hands. I went as quickly as possible down the hall to the bathroom so my mother couldn't hear me cry, and I thought, people must not really know. They can't really know because I didn't know what people went through until I saw it with my own eyes. She died anyway, but she had to starve to death over 3 weeks. I can't imagine being trapped in my own body, screaming in pain while my loved ones are tortured forever by what they see. I wake up sometimes at 3, 4 in the morning thinking about that day, and I'm angry at myself for not fighting for her right sooner, to not have to starve to death and be tortured in that way. The greatest thing about this law is you don't have to use it, but it allows others who have different beliefs to do so. By allowing this law, everyone wins. Everyone can have peace in their own way. So I urge you to vote in favor of the Senate Bill 775. Please don't wait until it's too late like I did. Thank you so much for your time.
Thank you, Ms. Tully. Any questions? Seeing none at this time, thank you for your testimony this evening.
Thank you.
Next, I believe we have Theresa Cody on the line. Welcome to the committee. You have 3.5 minutes for your testimony, ma'am.
Thank you, Chairman Klein, and I want to thank all the members of the Senate Judiciary Committee for listening to me today. I oppose Bill 775, and I want to say that if assisted suicide for terminally ill patients is legalized, it's not hard to imagine that the criteria for terminal illness will expand in a few years, and I believe Dr. Giuseppe Butera spoke about that very clearly earlier. In Oregon, diabetes is listed as a disease for which patients have received assisted suicide. And in Canada, which legalized assisted suicide and euthanasia in 2016, the criteria has rapidly expanded to include people with mental disorders as well as younger children. I feel that if this bill is passed, there will be other people involved in the end-of-life decisions for you. Assisted suicide gives insurance companies and governments the ability to save money by pushing lethal drugs that are less expensive than treatment. It has happened that way in Oregon and California, where patients, including people with disabilities, were refused coverage of life-saving treatment and offered lethal drugs instead. I personally do not want to be faced with a terminal illness or maybe even a long-term illness where I will be denied treatment by my insurance company and offered medication to end my life. That totally frightens me. I'm concerned for people who have disabilities and the elderly, and I feel that we should not pass this bill. Thank you.
Thank you for your testimony. Any questions of committee members? Seeing none at this time, thank you for joining us this evening.
Thank you very much.
Okay. Next, we have Lennox Smith. Welcome to the committee. You have 3.5 minutes for your testimony, ma'am.
Thank you very much. Hi, this is Lennox Smith. I live in North Scituate. I'm here today in support of this bill. It would be bringing tremendous peace and calm to my life. I live with 2 incurable conditions. I've had 9 catatonic episodes in front of my husband and had my life saved by getting a neck fuse. But there is a point in life where I know I potentially will have no more hope in my life. I love life. I do everything I can to stay alive. But when that point comes, the thought of having to suffer until my last breath is beyond my imagination of how I'm going to cope with this. This bill would bring peace to me, knowing that in time, if I got to that point, I would have a way to peacefully leave this world. I recently lost my service dog. It was the hardest thing I had to do to put her down. But I put her down. She could no longer think. She didn't know what to do to help me. She didn't know how to move around. And the one thing that gave me comfort was the fact that I knew she was now in peace. And I think people in this state have the right to have that same option in their lives. This is not talking about suicide. This is talking about people who are terminal, who are in excruciating pain and have nothing to do but wait for that last breath. So I hope you will support this bill. I know it's a very touchy topic. Many people don't want to think about death, don't want to think about what to do at the end. But when you are like me and live with these conditions and you know this is coming, something like this would provide comfort beyond imagination to people that are coming towards the end of their life. So I thank you for listening. If anybody has a question, I'm happy to answer it. Are there anybody that wants to say anything?
Thank you very much for your testimony. Any questions of committee members? I don't see any at this time. Thank you, ma'am, for joining us this evening.
Thank you for listening.
Yes,
I appreciate that. You take care, and thank you for taking this on. Bye-bye.
Thank you. Next. We just had a drop call. 1 minute. What's that? Okay. Thank you. Our next witness, welcome to the committee. Our next witness is John B. Kelly from Second Thoughts, Massachusetts, Disability Rights Advocates Against Assisted Suicide. You have 3.5 minutes for your testimony, sir.
Thank you very much, Chair Coyne. My name is John Kelly, and as you said, I am the New England Regional Director for Not Dead Yet, the National Disability Rights Group, long opposed to assisted suicide. I am also the Director of Second Thoughts, Massachusetts. Our progressive, social justice-oriented advocacy has helped stop a state referendum in 2012 and 4 bills since. People talk about choice at the end of life, but what we see is the end of life choices. Choice gets taken away because of insurance treatment denial. Assisted suicide will always be the cheapest treatment. We also have the issue of persuasion and coercion all the way up to abuse. Assisted suicide proponents keep stating falsely that there have been no abuses in Oregon or any of the other states. I ask people to search for the name of Wendy Melcher, a trans woman who was very ill but had not enrolled in the assisted suicide program. 2 nurses, one of whom was having an affair with Wendy's partner, conspired to try to kill her with massive doses of suppositories. Rather than being referred for criminal prosecution, the 2 nurses were dealt with in secret by the Oregon Nursing Board. One was put on probation for 2 years, and one was had a license suspended for 30 days. Wendy's family did not learn of how she died until a reporter called their family 2 years later. If this bill is passed, S775 would result in people losing good years of their lives because of medical mistakes, insurer denial, and abuse and coercion. Studies show that 12 to 15% of people who enter hospice outlive their 6-month prognosis. In its 2020 report, Oregon reported that in 23 years, 77 people, or 4% of the total, outlived their prognosis. In other words, they were not dying. That 4% figure matches the percent of innocent people sentenced to capital punishment. That's one of the main reasons that progressive states like Rhode Island abolished it. If those 4% of innocent people's lives are valuable enough to reject capital punishment, the 4% of innocent people who lose good years of their lives to assisted suicide should be reason enough to stop passage of assisted suicide. I would also like to correct the sponsor of the bill who misspoke when he said that a doctor prescribing assisted suicide would have to be trained in the specialty for the disease at hand. That is not so. Please value equally the lives of innocent people. And I am paralyzed from the neck down in common parlance, and I see a constant barrage of people saying that people like me have no quality of life. I love my life. The state should not be coming down on the side of one group of people who would rather die than live out their lives and maybe live many more years. Thank you very much.
Thank you.
Defeat this bill.
Thank you for your testimony. Any questions for this witness? No questions at this time. Thank you, sir, for your testimony this evening.
Thank you.
Welcome to the Committee on Judiciary. I believe it's Ellen Lay on the phone. You have 3.5 minutes to testify, ma'am.
Thank you.
You may begin.
I'm speaking today out of concern that there will be negative repercussions for the aging population, disability community, and society at large. I am very much in opposition to this type of legislation, as it can be a slippery slope. The proponents have said that there have been no issues when passing this type of legislation, but that is not true. There have been many issues, and the problem is that people are just not there as objective observers to be able to tell when something does go awry. It's a slippery slope, and this type of legislation does not get reversed once it passes. So we must pay close attention and care to prevent such tragedies. Care must be available so people can receive services to help maintain independence and provide palliative care so that people truly have choices. As long as there are health inequities and medical bias against marginalized communities, then we must not pass laws that leave people vulnerable to suffering, discrimination, and health care. The majority of people in Black and Latinx communities oppose this type of bill. All of the major national disability rights organizations are also against assisted suicide. Abuse of elders and people with disabilities is too large a problem to ignore, and these communities are vulnerable to coercion, sometimes directly, other times more subtly. We must not make it harder for people with suicidal thoughts and histories who also suffer to stay alive when they're subjected to this confusing message. We need to take care of each other and not reinforce through legislation that we're a burden to society as we age, become disabled, or are dying. Let's not make the choice to die become a duty to die. People should not die because they're made to feel a burden. There are many valid reasons why people who understand the very complicated nature of these issues are opposed to this type of legislation, and this includes the American Medical Association. Let's pay attention and not proceed with passage of this dangerous public policy. Thank you very much.
Thank you for your testimony. Any questions of this witness? Seeing none at this time, thank you very much for joining us this evening.
Thank
Our next witness, I believe, is Sovia. Welcome to the committee. I'm going to ask you to please pronounce your last name.
Hello? Can you hear me?
Could you lower the volume in the background? We have some background noise.
Okay.
Very
that
good.
better?
If you could please state your name again, and you have 3.5 minutes to testify, ma'am.
Thank you, Madam Chairman and committee members. My name is Zofia Grzegorzewska, and I live in Smithfield. I'm going to make my testimony a little bit shorter, just to start with one of my personal stories. 2 months after me and my husband got married, our first Thanksgiving, he woke up. The day after our first Thanksgiving, he woke up half paralyzed. He could still walk, but right side of his face dropped, and he could not control his right arm and had speech difficulties. That morning, my heart dropped to the floor. My husband had stroke, was my first thought. But that's not possible at his age. Our immediate visit to ER ended with my husband's stay at the hospital for 10 days. With no diagnosis, it wasn't stroke. We struggled for years to get him diagnosed, and meanwhile, John's health degeneration was progressing fast. Additionally, to above symptoms, John was losing his consciousness from time to time, and I had to get into routine to call 911 and perform first aid until ambulance arrived. One night, I had to do this routine, and when we got to hospital, John regained some of his consciousness. But then he grabbed my hand and squeezed it really tight and said, "Don't leave me, please." John's words are hidden deep in my heart. His will to live was tremendous. I am very positive. Just like my husband, many wants to say, "Don't leave me, please. Help me live." In the end, I did get diagnosed. It was multiple sclerosis. In 2013, my husband passed away from natural causes of sleep disease. My life experience helped me in my professional field. For 16 years, I took care of special needs people with RA spectrum disabilities. I witnessed firsthand how cruel their treatment is sometimes. Starting with doctors who, directed by BS, don't give them enough care, or additionally, will prescribe new medications to check for patient reactions. I witnessed skin rashes, hives, and all kinds of allergic reactions to new medications on the market. But special needs were first to be lucky prescribers. Make and bill 775 legal makes special needs population to be open to such practices as described by this bill. We should not leave patients when they need our company the most. We should not look at another person and be the one to say, "Yes, you're right. This world will be better off without you." Don't involve our state in life-ending activities. Dear Madam Chairman and committee members, I plead with you, vote no and oppose the bill 775. Life is beautiful, and we want to live in dignity. Let's be national example and state where life is cherished and protected. Please show love, care, and compassion for another person. Thank you.
Thank you for your testimony. I do not see any questions at this time. Thank you for joining us this evening.
Thank you very much.
Mm-hmm. Welcome to the committee. I believe it's Jean Ernster on the line. You have 3.5 minutes for your testimony.
Okay. Hello. Thank you for taking my call, Madam Chair and members of the committee. Yes, my name is Jean Ernster. I am calling from Barrington, calling to oppose the bill 775. My concern is the risk of dangerous unintended consequences of this legislation to vulnerable members of society outweigh any potential benefit. For the sake of the 1% of citizens requesting it, I compassionately urge you to focus on improved disability and palliative care legislation. It is my understanding that this industry operates without any medical association oversight and therefore opens the door to certain unintended consequences. The first one is denied treatment. I heard someone mention that. I've read about a situation with a person named Barbara Wagner who was denied chemo payments and offered lethal dose instead in the state of Oregon. And I've heard of a case of Randy Troop in California, who was denied pain-reducing treatment for prostate cancer care. Also, another unintended consequence is of that 1% of people receiving lethal dose, a third of them actually don't take the drug, and that lethal dose is unaccounted for and can get into the wrong hands, sold on the black market, and could potentially kill other people. And then, as other people have mentioned, coercion. The New England Journal of Medicine calls exploitation of older adults as a virtual epidemic, with 1 in 10 being affected. This invites more abuse and coercion of our older adults. Also, in the state of Oregon, where assisted suicide is legal, the overall suicide rate has increased about 41% above the national average. So very concerned about some of these unintended consequences. At the same time, do have great compassion for those who are trying to find a solution. Thank you so much for taking my call. And let me know if you have any questions.
Sure. Thank you so much for your testimony. I don't see any questions at this time, but thank you for joining us this evening.
Okay. Thank you.
Next up, we have William P. Mckenna. Mr. McKenna, you have a total of 3.5 minutes to testify, and I know you're testifying on a couple of bills. Please state the bill number and then the testimony. But you have 3.5 minutes, please.
Okay. I don't know the bill number, but one's on assisted suicide, and I'll testify on one statement on all the abortion bills.
Yes.
One of the leading reasons for requesting lethal drugs for suicide is the concern for being a burden on caregivers. Instead of reassuring people that we think of them as precious loved ones and no burden, assisted suicide reinforces the feeling of being a burden on the part of seniors. There are simply times in life where it may be our turn to be on the receiving end of good care, often after a lifetime of generous caring toward others. Instead of facilitating suicide, let's adopt the ethics so well expressed in the song, "He Ain't Heavy, He's My Brother." "His welfare is my concern," the song goes. "No burden is he to bear. If I'm laden at all, I'm laden with sadness that everyone's heart isn't filled with the gladness of love for one another." The song "The Dutchman" talks about a man who, with impaired mental faculties, and his compassionate wife Margaret, who offers him not lethality, but loving accompaniment. The song goes, "Sometimes he thinks he's still in Rotterdam, and he watches the tugboats down canals and calls out to them when he thinks he knows the captain, till Margaret comes to take him home again, through unforgiving streets that trip him though she holds his arm. Long ago I used to be a young man, and Margaret remembers that for me." Let's reject a societal vision where people are disposed of and promote one more in keeping with the loving commitment of people like Margaret. On the abortion bills, the notion behind the so-called equality in abortion coverage bill reminds me of Emerson's statement that a foolish consistency is the hobgoblin of little minds, and General Buck Turgeson's remark in Dr. Strangelove that, "Gee, I wish we had one of them doomsday machines." If abortion, which is harmful to both women and babies, is covered by some insurance plans, then gosh darn it, the sponsors want it covered by all plans. Human flourishing seems less important than equal coverage, even if it is for something that deprives a person of his life. It is not enough for the sponsors to have us acquiesce to the dismembering of human beings by abortion. They want taxpayers to pay for it. Contrast this equal coverage for an evil approach with the pro-life bills being heard today. They seek to protect human life before and after birth and require abortion clinics to have licensing requirements similar to other health facilities, and inspections. Those who don't think that inspections are a good idea ought to learn more about the operation of abortionist Kermit Gosnell. I urge the committee to do the right thing which is to do what protects human life. Thank you very much.
Thank you very much for your testimony, sir. I don't see any questions at this time. Thank you again for joining us this evening.
Thanks very much.
Sure. Monica. Welcome to the committee. I believe we have Monica Leandra on the phone. Ma'am, you have 2 bills you're testifying on. You have 3.5 minutes. You may begin.
Thank you. Again, I'm Monica Leandri from North Providence, and I oppose Bill 775. There are so many reasons that this bill is bad law. First, there is nothing compassionate about killing someone by helping someone kill himself. The word compassion means to suffer with. You show compassion to someone when you walk through their struggles with them. Killing them shows a blatant disregard for their humanity and the goodness that they bring to the world simply by existing. If someone is suffering, then we should do all we can to eliminate that suffering without eliminating that person. Many elderly people now believe that they are a burden to their families. They actually contemplate suicide for this reason, because they have learned that to be old is to be a burden. At one time, the older you were, the more respected you were. Now the elderly have learned that they are just trouble. That's a message that our society is sending. That's a message that this bill is sending. We need to pass laws that protect all people, not push them to suicide. Although there is still some suffering in the dying process, much of this pain can be and should be alleviated. We should put our efforts into increasing and improving palliative care. Assisted suicide laws get passed because we tend to think that someone needs to relieve their suffering. However, most people who actually choose assisted suicide do it for other reasons. Most often, fear of a loss of autonomy. Not even actual loss of autonomy, but the fear of it. Suicide is a bad response to that fear. When I listen to previous callers suffering through diseases, I hear that fear in their voices also. When you can illegally kill anyone, no one is safe. As I'm getting older and approach my natural death, I don't want to have to worry about whether my doctors will actually try to care for me. I don't want to worry about whether my insurance company thinks my life is worth the cost of treatment. Giving someone that choice to kill themselves will ultimately force that bad choice on the rest of us. And we know that suicide by young, healthy people always increases when suicide for the dying is made legal. Please show your concern for others by voting against this horrendous bill. Simply put, this bill puts each one of us at risk. The second bill I wanted to speak on is Bill 267. I also oppose this bill. I personally know of at least one person who contemplated having an abortion and would have done so if it was free to her through Medicaid. But she got through that scary part of her pregnancy when you first find out and are filled with confusion. And then she did come to love her child the way a mom should love her child and regretted her initial decision. For many years, we've been told that women have the right to abortion, but that came at a cost, and we have lost our right to motherhood. It's bad enough that Rhode Island passed this horrendous law last year, which will kill many more of our sisters and brothers. Please don't make each one of us, an accomplice to this killing by forcing us to pay for it. Thank you.
Thank you for your testimony. I don't see any questions at this time. Thank you for joining us this evening.
Thanks. Bye-bye.
Bye-bye. Welcome to the committee. I believe we have Denise Webster on the line. You have 3.5. Could you do me a favor and turn down the volume in the back that you have on? We have some.
Is that better?
Yes, much better. Thank you. You have 3.5 minutes to testify on both the bills that you're interested in, 775
Okay.
and 645.
Thank you. My name is Denise Webster from Bristol, Rhode Island. I appreciate the opportunity to testify. And for Bill 775, the assisted suicide, I am against for many of the reasons that you have already heard. And so I will try to just add a little bit of information to what you've already heard. According to the National Institute of Mental Health, The assisted suicide rate in 2018, according to the CDC, was the 10th leading cause of death in the United States, which was a number of 48,000 deaths. So there are 2.5 times as many suicides, which is the 48,000, as there were homicides, which was 18,830. So when you look also at the demographics for ages and gender, females had the highest suicide rate at ages 45 to 64 at 10 per 100,000. And male suicide rate was the highest at age 75 and plus, and that was at 40 deaths per 100,000. So also, what I didn't hear at this point was the immunity for doctors, which to me raises a huge red flag. I think that when you see something like that in the bill, that to me that's a basis for we already know it's wrong. So I certainly do not agree with that. So I would oppose that law. The second one is the 267, and which is the taxpayer. I do not believe. I sent in written testimony on that, which included an article written by Conover, and it's Are Americans Paying for Abortions? So I included a piece of that I thought would fit along with a graphic. So what I would just like to say about that is that we already, as taxpayers, both federally and state, pick up 25% of all the abortion costs in the United States. So 6%, almost 7%, are borne by federal taxpayers, and the remainder, which is 17.4%, are picked up by state taxpayers. So if they apply the 24% figure to the total number of abortions, this is equivalent to taxpayers paying the full cost of 250,000 abortions a year, with about 70,000 financed by a federal taxpayer and 180,000 financed by state taxpayers. I believe that we're already paying for it, and I think that there are enough members in the state, citizens in Rhode Island, that if it were put to a referendum, would not agree to either one of these two bills. So I thank you for your opportunity. If there are any questions.
Thank you very much for your testimony. I don't believe there are any questions at this time, and we appreciate your testimony this evening.
Thank you.
At this time, that finishes our public testimony on 775. We're now moving to Senate Bill 267, Equality and Abortion Coverage. Good evening. I believe we have Beth Cronin from the American College of Obstetricians and Gynecologists to testify on 267. Welcome to the committee. You have 3.5 minutes, ma'am.
Excellent. Thank you so much, Senator Coyne and members of the Senate Judiciary Committee. My name is Beth Cronin. I'm an OBGYN practicing here in Providence. I've worked in Providence since 2006 when I started my residency training at Women and Infants. I currently serve as the Rhode Island Section Chair for the American College of Obstetricians and Gynecologists, and I'm honored to be here tonight on behalf of ACOG and the Rhode Island Medical Society to testify in support of Senate Bill 267, as well as in strong opposition to both Senate Bills 664 and 669. The Rhode Island section of ACOG represents over 140 physicians and partners in women's health in our state. ACOG is one of the leading authorities on women's health and is committed to public policy based on facts and evidence-based medicine. Abortion is an essential component of healthcare. Like all medical matters, decisions regarding reproductive health care, including abortion care, should be made by patients in consultation with their clinicians without undue interference by outside parties. All patients, individuals seeking abortion, are entitled to privacy, dignity, respect, and support. Senate Bill 664 is unnecessary and inflammatory. The only identifiable goal of this bill is to try to criminalize doctors and medical care and create a culture of fear. Medical guidelines and ethics already compel us to facing life-threatening circumstances to respond in the best interest of the patient. This bill is vague, poorly drafted, and could criminalize doctors who are helping patients in complex and often tragic circumstances. This bill outlines the theoretical scenarios that are so incredibly far-fetched that would create a chilling effect and limit access to safe legal abortion, since many physicians may fear prosecution. Senate Bill 669 poses a serious threat to women's health by ignoring an individual's needs and circumstances and seeking to ban abortions at 20 weeks. The sponsors of this bill are using faulty science to deny Rhode Islanders the dignity to make personal, private decisions. Bans on abortion after 20 weeks are often based on unproven assertions about fetal pain. Medical experts are in agreement that science does not support these claims. The fetus does not have the capacity to experience pain until after viability. Neuronal structures and brain structures to process these signals do not develop until well after 24 weeks. I'd now like to shift to discuss the Equality and Abortion Coverage Act, or Senate Bill 267, which will treat all Rhode Islanders fairly by adding coverage of abortion to our state Medicaid program, covering 315,000 Rhode Island residents, as well as eliminate harmful laws that prevent more than 17,000 state employees and their dependents from using their insurance to cover abortion. Rhode Islanders strongly supported the passage of the Reproductive Privacy Act in 2019, which was a huge step forward to protecting the right to abortion in our state. Now we need to take the next steps to ensure all people in our state can access safe and legal abortion by passing this law. Despite recent declines in unintended pregnancy, disparities persist, in part due to long-standing systemic oppression and racial inequality. Low-income women and women of color are more likely than other groups to experience unintended pregnancies and abortion. First implemented in 1977, the Hyde Amendment, which forbids the use of federal funds for abortion, except in cases of life endangerment, rape, or incest, has guided public funding for abortions under the joint federal-state Medicaid program for low-income women. I'm here today fighting for abortion justice to ensure that care is there for all of us, whoever we are, wherever we live, whatever type of insurance coverage we have. Regardless of how each individual feels about abortion, politicians should not be able to decide what types of medical care people get, particularly low-income and people of color. You have the power to open up access to all Rhode Islanders to receive equal access to this essential healthcare service. The cost of an abortion is significant, and these costs are not affordable for the majority of low-income individuals. Whenever I counsel a patient with an unplanned pregnancy on options for care, and she tells me that she wants to proceed with abortion, my thoughts then become, what type of insurance does she have? How much will this cost? What can I do to help facilitate her getting the care she needs?
Thank you, Ms. Cronin. If you could
completely
just,
unfair
Ms. Cronin,
that
if you could
because
just,
of my private
thanks. If you could
health
just try to
insurance,
wrap it up, I've let you go a little longer. If you could just wrap it up,
Yep.
please. Thank you.
Because of my private health insurance, I would have coverage for an abortion if needed, but my patient, who works 3 jobs to feed her family and relies on Rhode Island Medicaid for her health care, would have to decide whether or not to feed her children or skip paying for heat this month in order to access the same service. The consequences of being able to obtain abortion profoundly impact a person's life, health, and well-being. And on behalf of Rhode Island Medical Society and ACOG, I strongly urge you to pass Senate Bill 267 in order to ensure that every patient, every individual in this state can access equal access to abortion care.
Thank you, Ms. Cronin. Thank you. Are there any questions for this witness? Any members of the committee? No, thank you very much. Our next witness is Tammy Brown with the Women's Project. Good evening, Ms. Brown.
Hello.
Yes. Welcome to the committee. You have 3.5 minutes. You may proceed. Thanks.
Okay, thank you so much, members of the committee. My name is Tammy Brown, and I'm on the board of directors for the Women Project. Now more than ever, we need a society that leads with compassion and puts science and our families' health, safety, and real-life needs first. As we've seen during this pandemic, people of color face more risks and bigger gaps when it comes to health care. The story is no different when it comes to abortion care. The policies that we have in place in Rhode Island that take away health coverage for abortion for state employees and for people who use Medicaid cause harm and further exacerbate health disparities. That's why I'm here to strongly support Senate Bill 267, which gets rid of these bans. Women of color are overrepresented in low-wage jobs and more likely to use the state Medicaid program to get their health care. So this means that state bans on Medicaid coverage for abortion fall hardest on women of color and takes away our right to make our own health decisions. What we have now is a policy that tells state employees and low-income Rhode Islanders that if you have money, you have the right to an abortion. If you don't have the financial resources and you can't pay for it out of pocket, then the right isn't real. I believe that lawmakers have a role and a responsibility in figuring out how to solve issues of inequality. We need to do more to eliminate barriers to health services, especially those that disproportionately affect poor women and women of color. This is a matter of racial justice. If we truly want to support families and women, there are many policies that we can advance, and this is one of them. Everyone deserves to have accessible, effective health care, including abortion care. As we grapple with huge questions around racial and health equity, this is a step we can take. Our state law treats the right to abortion according to two different standards, whether you can afford to pay for it or not. That's not equality, and that's not okay. Repealing these restrictions will not by itself ensure full equality for poor women and women of color in the healthcare system, but doing so is a necessary precondition. Anyone who cares about fighting racism and poverty must realize that attacks on abortion, and especially on abortion coverage, are the first and foremost attacks on poor women and women of color. In a crisis, the people that have the least hurt the most. Everyone deserves to have accessible, effective health care, including abortion care. I urge you to support Senate Bill 267. Please vote yes on this important bill. Thank you.
Thank you, Ms. Brown. Are there any questions for Ms. Brown from any members of the committee? No, thank you very much for your testimony.
Thank you.
Our next witness is Lynette Labinger from the ACLU of Rhode Island. Good evening, Lynette.
Yes.
Yes, welcome to the committee. You may proceed. You have 3.5 minutes, please.
Thank you. I will do my best to get through. This is on behalf of the ACLU of Rhode Island. My name is Lynette Labinger. I'm a cooperating attorney for the ACLU. And the ACLU is opposed to passage of bills 645, 664, and 669, which would restrict abortion, and strongly supports passage of Bill S267, which would repeal long-standing unfair and inequitable funding restrictions. Just 2 years ago, the legislature carefully crafted the Reproductive Privacy Act, which codified federal constitutional standards known as the Roe versus Wade requirements, and also guaranteed that the state would not interfere with access to evidence-based medical care or treatment. At the same time, the RPA retained and reaffirmed a number of other existing limitations, including General Law 11-9-18, which makes it a felony with conviction up to manslaughter for knowing and intentional failure to provide medical care when there is a live birth during an attempted abortion. Senate Bills 645, 664, and 669 are designed to and will completely disrupt the carefully crafted resolution and are unconstitutional under Roe standards. If passed, they would be subject to immediate legal challenge and would needlessly embroil the state in federal litigation and exposure to the award of substantial attorney's fees to the successful challengers. Bill S664, the Born Alive Infant Protection Act, is unnecessary. Rhode Island already has a criminal statute. But this bill would do much more and interfere with and criminalize medical procedures and termination decisions protected by the RPA and Roe. It effectively bans termination of a pregnancy at any gestational age by redefining the mandates of providing medical care to the fetus without regard to viability. Bill S669 also substitutes its own judgment for those in the medical community, declaring a critical time frame for when a fetus is purportedly capable of feeling pain, which it would advance to some date earlier than viability on a politically declared standard instead of a medical standard, and would replace the exception for post-viability abortions that they are allowed when necessary to preserve the life or health of the pregnant person, with a new standard which is unconstitutional. Our shared experience during the past year should strongly counsel against this legislation, which purports to let politicians decide instead of science. Senate Bill S645 is equally transparent in its goal to close healthcare facilities where abortions are performed, or to make continued provision of such services so onerous and expensive that the providers will decide to stop providing the services. It would apply to hospitals. It would require, in the event of any finding of an infraction or license deficiency, even one that's trivial and easily correctable.
Ms. Lavenger, let me stop you for a minute. We have a question for Senator Dela Cruz. Senator Dela Cruz?
Okay.
Thank you, Chair Archibald. So, Lynette, you mentioned here that Bill 664 and 645 prohibit abortion, but they do not. So I would like to know exactly how do you see that they prohibit abortions?
Well, anything that changes the standards and moves away from Roe, the Roe standards, and the RPA, which did nothing but codify the Roe standards, is creating burdens and restrictions on abortion. And by creating new definitions and saying that you can't have a procedure when the fetus is capable of pain, and we, the legislature, are defining that as 20 weeks, when viability is a medical standard, which is generally pegged, though each case is different, at 24 weeks, is advancing the restriction to an earlier date, and then also creating a different standard
let me interrupt you, Ms. Lavenger. Let me interrupt you, Senator. Ms. Lavenger, let me interrupt you, please. If a senator raises their hand, we always interrupt, and the senator gets to ask the question. That's part of the procedure with the committee. Go ahead, Senator Dela Cruz.
Yes, I'm going to be very clear here. The two bills that I just mentioned were 664 and 645. We can talk about 669 at another time if the chair permits. I'm speaking through the chair. So I'd like to keep it to the topic at hand. Bill 664 that I've proposed and Bill 645 do not in any way whatsoever prevent abortion. So I would like to know, since the statement was made that it does, I would like to know how specifically does the representative from ACLU see that in my legislation?
Okay, I'm sorry. I did not. I don't have the same command of the numbers that you do. Focusing on 664, which I do not have the actual language in front of me, I believe that it requires the provision of medical care to the fetus at any gestational age without regard to viability. And therefore...
No.
That's okay. Senator Dela Cruz.
That's how I read it. I mean, I can't...
The bill 664 says that a baby born alive would be afforded the same rights as any other individual outside of the womb, medical care, regardless of whether or not it was, regardless if they were born after an attempted abortion or if the baby was wanted. It has nothing to do with care inside of the womb.
Ms. Lavenger, did you have a follow-up?
I have read the language where it does not say anything about viability. And if it doesn't say anything about viability, then, and it's got criminal penalties, then it is at any gestational age, as that's how I read it. And it does not have the language that you've indicated that puts a critical date of post-viability.
Thank you. Senator Dela Cruz.
So I would encourage you to read the bill again, because that is not what the bill does. It is a protection for infants born regardless of their circumstance at birth. And I would also note that, yes, perhaps there would be attorney fees and litigation associated with this legislation if somebody were to try to terminate the child outside of the womb, but that's not a reason not to protect the voiceless.
Well, I believe that there is a current statute that covers exactly the issue of an infant born alive at the point of an attempted but failed abortion, and that's 11-9-18, which is already on the books. As far as, and I can address 645 if you would like or not.
Yes, please, if you would. We just need to be as quick as we can. I know we interrupt because Senate questions, but I've let you go.
Sure, no, and I turned my picture off, so I don't know that anybody's raising any hands. So I don't mean any disrespect to anybody, but I didn't know how to do it without.
No, I'll take care of that. That's okay. Go ahead. You can respond. Go ahead.
Yes, 645 does not per se restrict abortions. What it does is it makes it so burdensome and onerous for a facility that provides an abortion that they are either not going to provide them anymore, or they face the potential of being shut down because of any trivial or easily correctable infraction. This is something that we have seen across the country where onerous provisions are required and imposed that make it difficult or infeasible to continue to operate the facility. And in this case, because it applies to any facility that might provide a termination, it would appear to also include hospitals, and would be a strong incentive for them to avoid continuing to provide any termination of procedures to avoid this kind of onerous language. And that is why I believe it does burden abortion procedures. It may also, as I was starting to say but didn't get that far, violate licensing property rights and deny due process.
Thank you. Senator Dela Cruz.
Thank you, Chair. That's a bit of a reach that would deny property rights. In fact, that's quite a reach. But regarding the standard of care, this standard of care that is in the bill does not exceed the standard of care in which we're currently giving and providing here in Rhode Island. It says to come in line with similar facilities. So it is not onerous. And I highly doubt that it would prevent abortions. It would make them safer. It would ensure that the women that are going into those facilities are receiving the top level care. And the performing abortions is a very lucrative, I'm not going to say business, but Planned Parenthood is in the business of abortion. So it's very lucrative. I doubt that they would want any kind of danger to their income. So it's not that we're asking them to do above and beyond what we've already established as a state for laws regarding other medical facilities. It's to come in line with that. And when in 2019, there were no inspections of the abortion facilities for 10 years straight, I can hardly call that as safe for women. We're just trying to ensure that every year, Planned Parenthood has an unannounced inspection, as does any facility, even a McDonald's restaurant that you would go to. You don't let the Department of Health know, they don't let you know that they're coming so that they can have everything nice and neat and everything's clean. You come in unannounced. Now we're not saying that the Department of Health is going to walk into a room where a woman is having an abortion performed. Obviously, that's not going to happen. So I think it's disingenuous to say that this bill prohibits abortions, because it clearly does not.
Thank you, Senator Dela Cruz.
If I may respond.
Yes, briefly if you could, and then we're going to move on. Thank
I will try. I am well aware that all freestanding surgical centers are highly regulated and subject to all sorts of licensing requirements and inspections, as are hospitals. And they're already subject to all sorts of restrictions. There is informed consent restrictions. To single out providers who provide abortion services is very onerous. And on top of that, it would the mandatory annual inspection, in particularly when we think about these last 12 months, would basically require the Department of Health to drop its priorities in a pandemic and refocus its resources in compliance on this bill. And I would strongly urge against it. I would like to just say, before I run out of total time, that we strongly support Senate Bill 267, and it would repeal a long-standing and unfair and inequitable funding restrictions that interfere with individuals' right to health care and to exercise their right to abortion without undue government influence. You've already heard from both sponsors, both in the Senate and the House, so I'm not going to repeat what they have to say. I will just observe that with respect to the state employees, many years ago, the ACLU challenged that restriction. We were successful in challenging it as to municipal employees, but the state was able to decide that it was going to withhold this benefit to its employees and their families. And in the course of developing that challenge, we learned that it saves the state no money at all.
Thank you, Ms. Labinger. Thank you. We're going to wrap it up there. Thank you. Senator Dela Cruz has one follow-up question. That's the last question. Then we're going to move on to the next witness. Thank you. Senator Dela Cruz, your microphone is muted. There you go.
Thank you, Chair. Just thank you for that last comment there. If in the time of COVID, I've heard many of my constituents who have restaurants say that the Department of Health has been on top of it, and they're checking their restaurants quite frequently. And if we can do that at a fast food restaurant, at a restaurant in town, then certainly once a year we can provide an inspection at an abortion clinic. Thank you.
Thank you, Senator Dela Cruz. Our next, Senator Oyer.
Thank you, Chair. I just wanted to just make a quick comment on this, and thank you, Lynette, for your testimony. I think it would make sense, maybe this committee can request from the Department of Health some details for the committee about what the current regulatory process is that clinics go through for inspection and licensing. Because again, I just wanted to re-raise a point that I had raised earlier, that facilities that are providing abortion procedures should not be subject to additional restrictions. So I think I would find it helpful, and I think it would be helpful to the committee so that we had a briefing from the Department of Health on this. Not a briefing, but just some submission from them as far as what that regulatory process is.
Thank you very much, Senator Royer. We can certainly look into that and get that information. I'm sure the clerk, Joe Baxter, will follow up with that. Thank you. We're going to move on to our next witness, Britney Fontano from Planned Parenthood of Southern New England. Good evening, Ms. Fontano.
Good evening,
Yes.
Chairwoman Coyne and members of the Judiciary Committee.
Welcome to the committee. You have 3.5 minutes, please. You may proceed.
Thank you for hearing my testimony. My name is Britney Fontano, and I am the Chief External Affairs Officer for Planned Parenthood of Southern New England, or PPS&E. We are Rhode Island's largest provider of sexual and reproductive health care, serving over 10,000 patients annually at our Providence Health Center. In addition to sexual and reproductive health care, including abortion, we are a certified patient-centered medical home offering primary care. Today, I'll speak in support of S267 and against bills that would decrease access to abortion care. But first, I'd like to say thank you. In 2019, we made history by passing the Reproductive Privacy Act and protecting the right to abortion in Rhode Island. This was possible because of the hard work of thousands of Rhode Islanders and because of the 21 senators who voted yes. I thank all 21, and in particular, I would like to thank Chairwoman Coyne and Senator Oyer for the key roles you played in achieving that historic moment. That was an important step forward in protecting bodily autonomy and the human right to health care. But our work isn't done yet. Now we need to take that same energy to make sure every person can truly access safe, legal abortion. Put simply, the right to abortion doesn't mean much if you don't have access to affordable care. PPS&E strongly supports Senate Bill 267, the Equality in Abortion Coverage Act, introduced by Senator Bridget Valverde, and in the House by Representative Liana Kassar. If enacted, this critical bill would finally repeal the bans that deny abortion coverage for the more than 300,000 Rhode Islanders insured by Medicaid and for state employees. Now is the time to repeal these discriminatory bans and ensure that when we say people have the right to control their bodies, lives, and futures, that truly means everyone, regardless of who you are, where you live, or your income. These laws can and must be changed. If we want a healthcare system and political system that reflects our values of equity and justice, we must put an end to these laws, which enshrine and reinforce the legacy structures of racism and classism. We know that bans on abortion coverage impact Black and brown people and people with low incomes the hardest. This is a call for racial and economic justice in our healthcare and society. Together, we can do our small part to answer this call by passing the Equality in Abortion Coverage Act. It's time for Rhode Island to stand with the 16 other states like Maine, Connecticut, Massachusetts, Vermont, and New York that use state funds to ensure equity in healthcare by covering abortion under Medicaid. We must also end discrimination against state employees. Right now, our ban on state employee coverage means that we stand with states like Mississippi, Texas, and Utah. I'm confident that Rhode Island can join the majority of states that do not tell state employees what health care coverage they can and can't have. I would also like to share PPS&E's strong opposition of SB 645, SB 664, and SB 669. Our friends from ACOG and others will speak to the unscientific and harmful nature of the second and third. I would like to speak to SB 645. This misguided proposal seeks to stigmatize abortion care and perpetuate myths about the safety of abortion by insisting abortion providers require a higher level of oversight and inspections than other similar healthcare providers. Abortion is one of the safest types of medical procedures and is similar in terms of risk level to other gynecological procedures performed in doctors' offices every day. There is no reason to treat abortion providers differently than any other healthcare provider. The director of the Department of Health already has statutory authority to inspect and license all healthcare providers, including those who offer abortion services. In conclusion, I would like to thank you for allowing me to highlight Planned Parenthood of Southern New England's enthusiastic support of the Equality in Abortion Coverage Act. I'd be happy to answer any questions.
Thank you. Senator Dela Cruz.
Thank you, Chair. Again, I would like to correct the mischaracterization of my bill. It clearly does not implement any other further implementation of rules that are not for similar facilities. To say that it does is misrepresenting the bill. It says that the licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements as other similar healthcare facilities, meaning that they get inspected yearly. Thank you.
Thank you, Senator. Are there any other questions by any other member of the committee? Thank you very much for your testimony. Our next witness is Beatrice, and I want to pronounce this correctly, McGock?
Hello?
Hi, good evening. I'm not sure I pronounced your name correctly. Is it McGock?
It's McGeoch. If you say yuck, you've got it right.
McGeoch, yes, thank you. You have 3.5 minutes. You may proceed. Thank you. Our next witness is Beatrice. Go ahead, ma'am. You have 3.5 minutes. You may proceed.
Okay. Hello? It's McGeoch. Hello? Can you hear me?
Yes, I can, Miss McGeoch. You have 3.5 minutes. Go ahead. You may proceed. Thank you.
Oh, sorry. I'm on a delay. Hold on.
That's okay. You need to shut the background radio off and then just listen directly to us, and it'll go smoothly. Go ahead. You may proceed. You have 3.5 minutes.
Okay.
Thank you.
So thank you for the chairwoman and the committee members for paying attention and listening to my testimony. My name is Beatrice McGeoch. I'm from North Kingstown, Rhode Island, and I'm speaking in support of S267. Can you hear me all now? Is everything good?
We can hear you great. Go ahead, please.
Thank you so much.
You're
okay.
welcome.
This bill is going to impact many people, at least 97,009%, I think, of people in the state. And I wanted to share my personal experience from several stages in my life that are bringing me to testify today. Okay? So, first of all, I'm a state employee. So currently a state employee, and this change is going to affect my family now because it extends to the health services that are offered to state employees. So that's immediately important to me, but the stage of my life I want you to hear about is the experience I had as a low-income parent of young children. All of us know people who have had to take care of young children. It's very challenging. It's a tough time in life. When my children were about 1 and 4 years old, I was at home taking care of them full time, and I got health insurance from Right Care in addition to being on food stamps. It just was very challenging. Unfortunately, this is a typical experience for a lot of parents in our state. I want you to hear about what it was like for me. When you're trying to care for a family at poverty level, time slows down. Every decision becomes weighty. There's no real way to understand it. Many of you may have had periods of your life where you did have this experience, but if you don't, if you have not had that experience, you're blessed, and I want you to imagine having to make the decision between purchasing food and purchasing soap. It was a very tough time for me. I experienced it, however, as a temporary challenge. I eventually was able to go back to full-time work, and my economic circumstances changed. I knew women, though, who had a lot less power. They were less respected, and they were also living like this. We all saw each other in the supermarkets on the first of the month, and I knew that they too would often struggle to feed their families. Now, at that time, I never even considered that if any of us became pregnant in this economic status, we would not have had the support or resources to choose whether or not to undertake raising that potential child. For me, that would have been a truly nightmare scenario. I was already making so many difficult decisions every day about resources, and it just horrifies me to realize that many people are in this situation every year in Rhode Island. A reminder, 97,000 people affected right now. You've got to know every woman, every person who finds themselves pregnant is holding a responsibility for life and death that is not light. They have to look at the circumstances within and around them. I had to do this, and they decide whether or not those circumstances are the right ones into which to bring a new life. They know they have responsibility for somebody else's entire life story. Whether or not that child stays with them, the story always begins with their choice, and the choice should never be based on whether or not a person has access to money, a few $100s, or basic information about essential medical care. And we do so well in our state already. We recognize this in so many other ways, paying for all the other health care that relates to reproductive choice. So I just want you, again, to support this bill so that everyone who can get pregnant in the state gets our support to make the best decisions for their families and, by extension, for our whole community. Thank you.
Thank you very much. Are there any questions for this witness from any member of the committee? No. Thank you very much for your testimony. You have a nice night.
Thank you. You too.
Thank you. Our next witness is Jocelyn Foye. Good evening, Ms. Foye.
Hi, my name is Jocelyn Foye.
Yes, welcome to the committee. You have 3.5 minutes, and you may proceed.
Thank you so much. As I said, my name is Jocelyn Foye. I am a mother. I'm an artist. I'm a marketing director, as well as being the director of the Woman Project. I live, in fact, in District 37. I'm here to testify for myself in strong opposition to S669, which is a vaguely written ban on abortion later in pregnancy. Bans on abortion later in pregnancy ignore the reality that not all pregnancies go the way that families hope they will. Because each situation is different, we should protect the ability for people to make tough health decisions in consultation with those trusted and with the support of chosen health professionals who can help us to weigh all of the options in a difficult moment. There are many instances where people face complications later in pregnancy and may decide that they need to end the pregnancy. They may be trying to protect their health and their future fertility or facing a serious health issue. There are also times when people are forced to delay getting care because of barriers on access to care. There are also financial barriers, like restrictions that withhold insurance coverage for abortion. We need to try to understand and support people and get rid of barriers to care, not judge them or make already difficult situations that are much worse, or make the situations much worse. It is not our place to judge someone facing a difficult diagnosis or pregnancy complications, and we certainly shouldn't take away health care options. It's a bad health policy, and it's downright cruel. Whether it is abortion bans like this one that are being pushed throughout the country, or the laws that put up extra barriers like the one that are being addressed in S267, this is about a calculated agenda to take away all access to abortion. It is about taking away the ability to make our own decisions. It is not about a certain point in pregnancy or a certain health program. It's about trying to make care unaffordable and make it harder for clinics to provide abortions. Even if someone disagrees with the decision to seek abortions, or if they're uncomfortable with the circumstances where someone needs to get an abortion later in pregnancy, it isn't something we should interfere with. Each person should be able to weigh all their options with their health provider and know if they need an abortion, they can get compassionate care without judgment or barriers like bans on health coverage for abortion. I urge you to vote no on S669 and support S267 to make sure each person gets to make their own decisions about their health care based on what is best for them. Thank you so much for allowing me to have an opportunity to speak.
Thank you. Are there any questions for this witness from any members of the committee? Hearing none, thank you very much. You have a nice evening.
Thank you.
You're welcome. Our next witness is Barbara Colt with the, we couldn't get here, so we're going to go to Jordan Goyette. Good evening. Jordan Goyette?
Yes, hello.
Yes, welcome to the committee. You have 3.5 minutes. You may proceed.
Yes, thank you. I also signed up on 775, but I didn't get a call.
That's okay. You can wrap it right in. You can wrap it right in here, and you know what? I'll start you all over again. 3.5 minutes. Go ahead. You can proceed.
All right. Yeah, thank you. I'll speak on 267 first. I really want to thank Senator Valverde for introducing this. I think she covered it in very excellent fashion during her introduction. She said a lot of what I wanted to say. The fact that 1 in 6 women are low income. Over 75% of abortion patients are low income also. Over 60% are only in their 20s. And a similar share are also already have one child. And there was a lot of talk early on about the cost that this will be. And I want people to actually think about what the cost it is to this, to not only these people, as you've already heard, but the state as well and society, of forcing people into motherhood and forcing them to bring a child into the world that they will not be able to provide a decent life for. And imagine not just what that does to those people, but what it does to the rest of society. And on 775, I just wanted to tell you the story of Betsy Davis, who in July of 2016 invited a lot of her friends and family to a 2-day party over the course of a weekend in late July. And she asked them to come with an open mind and an open heart because she had ALS. She had struggled with it for 3 years. And the former painter could not only no longer do what she loved, but she couldn't perform basic tasks like brushing her teeth or scratching an itch. She couldn't stand on her own, and her caretakers had to translate her slurred speech for her. So over 30 people came from all over the country to greet her there. They brought instruments to play music for her. They ordered her favorite pizza. They made cocktails, and they watched her favorite movie on a silver screen. And then at the end of that Sunday night of that weekend, July 24th, she had her sister and a massage therapist roll her out to a canopy bed on the hillside of her home. And she took, I'm glad Senator Lombardi asked this question of what kind of drugs are taken by these patients. She took a mix of morphine, pentobarbital, and chloral hydrate, which are 2 other sedatives. And at 6:45 that night, she slipped into a coma, and 4 hours later, she gently passed away to sleep. And by doing this, her death didn't turn into the arduously long and suffering-filled process that it was supposed to. And her friends and family coined this as her last performance. She turned her departure into a work of art. And I think that everybody in Rhode Island should have the fair opportunity to take that into consideration. And everybody has the right to decide how their story ends and how they want to be remembered, not how the disease, not of what the disease will turn them into, but who they were. And not fear the path that death will take them through, but to be able to greet death like kindly and peacefully, like an old friend. So I thank you. I'm by no means an expert on the topic, but I'd be happy to take any questions.
Thank you very much. Are there any questions from any member of the committee? Hearing none, thank you very much for your testimony.
Thank you. Have a good night.
Thank you. You as well. Our next caller is Megana Nandi. Did I pronounce that correctly?
Almost. Meghna Nandi. So dear Chairperson Cindy Coyne and other members of the Senate Judiciary Committee,
thank you.
Thank you for the opportunity to provide proponent testimony for S267, the Equality in Abortion Coverage Act.
You have I don't want to interrupt. You have 3.5 minutes. I just want to remind you of that. I know you're ready to roll. So go ahead. 3.5 minutes. Go ahead.
Okay, thank you. My name is Meghna. I am a Providence resident and a fourth-year medical student and a future family medicine physician, and I'm speaking to you today to show my support of this bill, S267, the Equality in Abortion Coverage Act. This bill would eliminate state laws that prevent health insurance coverage for abortion for state employees and folks in the Medicaid program. So we already know that Rhode Island voters believe we should protect the right to abortion, and the General Assembly has already protected that right by passing the Reproductive Privacy Act. According to Rhode Island state law, then, abortion is reproductive health care, which all people have the legal right to access. The issue at hand today with this bill, then, is if access to safe, legal abortion is actually equitable in the state of Rhode Island, and given these state laws that exist that prevent health insurance coverage for abortion for state employees and folks in the Medicaid program, it currently isn't equitably accessible. And so these state laws that I've mentioned essentially make abortion inaccessible by rendering it unaffordable for many state employees and publicly insured folks. On the other hand, individuals with private insurance that do cover abortions or individuals with high-income backgrounds who have greater discretionary funds are more easily able to access abortion. So this law, these existing laws that prevent insurance coverage for Medicaid and state employees is inherently unjust and perpetuates existing health disparities across both race and income, as Black, Indigenous, and people of color, due to systematic racism, are more likely to have low-wage work and be covered by public insurance. So finally, passing this bill right now is especially urgent given that we are living through a pandemic. Barriers to healthcare are already exacerbated, and our communities are facing significant financial insecurity. As a medical student going into family medicine, I've rotated in various primary care clinics this past year and cared for many parents and families. I've seen that when healthcare services are unaffordable, patients are forced to make the impossible choice between their healthcare and providing for their children and families. Let's do the right thing and pass Bill S267, the Equality in Abortion Coverage Act, to ensure that people of Rhode Island, no matter their job or how much money they have, never have to choose between what is best for their bodies, what is best for their health, and what they need to do to support their children and families. Thank you so much.
Thank you very much. Are there any questions from any member of the committee? Hearing none, thank you very much for your testimony. Have a nice evening.
You too. Thank you.
Thank you. Our next caller is Dr. Michaela Mario Lemonic Arthur. Do I have that correct?
You got it.
Thank you. You have 3.5 minutes. You may proceed.
Hi, thank you for taking the time to listen to me this evening. I speak to you today as an employee who's worked for the state of Rhode Island since 2008. When I took my job in 2008, I was promised health care. At the time, our state employee health insurance was managed by the same company I'd been insured through for many years previously. But what I did not know is that this health care plan, the only one I could choose, ensured that one of my most basic health care needs would not be covered at all. Not covered even if I went to an in-network provider. Not covered even with a sizable deductible and coinsurance. In fact, prohibited from being covered. This remains the case today. As an employee of the state of Rhode Island, if I should need to terminate my pregnancy, I would face a bill that could total thousands of dollars. When I began advocating for the Equality in Abortion Coverage Act, the fact that we did not have insurance coverage for pregnancy termination was a surprise to many of my colleagues. I have heard stories about women who've experienced horribly traumatic situations, finding out their pregnancy was not viable or was risky to their health, and who learned only in the midst of navigating this trauma that their health insurance provided no coverage for them. No one tells us this. Providing abortion coverage probably ends up saving insurance providers money. Even if it didn't, it would cost at most pennies per person per month. But not providing it costs pregnant people who need abortion services thousands of dollars they do not have. The Women and Infant Hospital patient cost estimators suggest a benchmark cost of about $5,000 for an uninsured person seeking an abortion, and some abortions are far more expensive, especially in cases where health problems are involved. For the overwhelming majority of state employees, this cost would be more than their take-home pay after taxes and mandatory deductions per month. And we state employees have far more economic security than our fellow Rhode Islanders insured through Medicaid, who face even more dire circumstances when they discover their insurance is worthless to them in a time of crisis. I work extremely hard on behalf of the people of Rhode Island each and every day, but my dedication to my work and to our state is not repaid by a basic consideration of my fundamental need for adequate and equitable medical care. If I worked in the same job in other northeastern states, I would receive this coverage. Rhode Island is telling me, my colleagues, and our families that our health and well-being simply doesn't matter as much as it would if we worked in a neighboring state. Health insurance exists most of all to cover the most unexpected of health needs. No one expects to need to get an abortion, but about 3,500 people per year in Rhode Island do. That's about 1% of the people capable of carrying a pregnancy every year. That means you know someone, probably even a state employee, who's faced this lack of coverage. Maybe even one of your colleagues, since you honorable senators are state employees too. It's time to honor the promises the state made when it passed the Reproductive Privacy Act just 2 years ago and ensure that state employees and Medicaid recipients have access to the same health care services as those who carry private insurance. Thank you.
You're welcome. Are there any questions from any members of the committee for this witness? Hearing none, thank you very much for your testimony. You have a nice night.
You too. Thank you.
Thank you. Our next witness is Wendy Becker. Good evening, Ms. Becker.
Yes, good evening.
Yes, welcome to the committee. You have 3.5 minutes and you may proceed.
Thank you.
Welcome.
I'm testifying in support of 267, the bill to ensure full access to reproductive health care regardless of health coverage or income. I'm the chair of the social work department at Rhode Island College, where as state employees, we do not have abortion care included in our health coverage. I'm testifying on behalf of the faculty in my department. We couldn't agree more with the bill sponsors that access to abortion must be guaranteed to all Rhode Islanders, as the decision about when and whether to be pregnant impacts every aspect of our lives. We believe the government should not have the power to coerce someone into pregnancy, childbirth, or parenthood. It is and should be impossible to imagine that. However, for people whose insurance doesn't pay for abortion coverage, especially Medicaid recipients who are low income and disproportionately women of color, this is exactly what we could be doing. Abortion is legal. This bill doesn't change that. This is about whether we continue to discriminate against poor women and women of color in abortion access. This is about whether we continue to have a two-tiered system of reproductive health care based on insurance and ability to pay. We say, of course not. We simply cannot be a state where income determines bodily autonomy, where abortion is safe and legal only for some, where health disparities are perpetuated, where pro-choice does not always afford a choice. We urge you to act positively on this legislation. which is essentially a health care bill, a racial justice bill, a gender justice bill, and an economic justice bill. Please send it to the floor for a full vote. Thank you.
Thank you very much for your testimony. Are there any questions from any members of the committee? Hearing none, thank you. You have a nice evening.
Thank you.
Welcome. Our next member, strike that. Our next witness is Samantha Weiser with the Rhode Island Democratic Women's Caucus. Good evening, Ms. Weiser.
Hello, good evening.
Hi, yes, welcome to the committee. You have 3.5 minutes and you may proceed.
Hello, my name is Samantha Weiser, and I am here tonight to testify in favor of the Abortion Access and Equality Act. It is incredibly important that women everywhere and people who have uteruses and need access to this health care, no matter what their health plan is, whether it is public or private, have access to the same type of care. As you well know, currently under our laws, anybody who is on a state plan or Medicaid does not have access to these services that the people of Rhode Island and the people of the United States have deemed essential services for health care. It is incredibly important, especially in these times of pandemic health and inequality, that we expand this access to people of all healthcare plans. This is not only an issue of just pure healthcare, it's an issue of justice, as we know that people who are on plans such as Medicaid are people with less means, and they should not be given worse healthcare, less healthcare, than those of us who have private insurance.
Yes, hello, are you still there?
Yes, hi, sorry, I'm still here.
That's okay. Was that the conclusion of your testimony? You stopped
sorry,
for a minute. If that's
moment.
okay.
I lost my note.
I do that 10 times a day. You may proceed. Keep going. We're all here listening. Go ahead.
Great. Thank you so much. Just a moment. In addition, I would like to testify against some other bills that you are hearing tonight, which would be S645, S664, and S669. All of these bills seek to do the opposite of what S267 is trying to do by expanding access to health care for all people, regardless of their plan, regardless of their life situation. These three bills restrict health care access by redefining the start of life and also subjecting abortion health care clinics to unfair inspections that other clinics are not held to the same standard. It's clearly an attempt to simply, yet again, regulate out of existence necessary health care in the exact same way that current legislation that S267 seeks to repeal legislates out of existence health care for many people who need it. And now I am done. Sorry for the gap there.
That's okay. Have you concluded your testimony?
Yes, I have. Thank you very much. I'm happy to take any questions if there are.
Thank you very much. Senator Dela Cruz.
Hi, Sam. Thanks for testifying today. I know this is an important legislation for you. And I have to ask, and I don't want you to take any offense to it because I know that we've met a couple of times, but I would like to know, because on the two bills that you said that you were against, 645 and 664, you stated that it restricts abortion access, but it has nothing really to do with the woman's choice to choose. And then you also said that it's unfair, and that it's not the same standard. But the bill 645 clearly states on line 4 on page 1, it says licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements as other similar healthcare facilities.
Go ahead, Ms. Weiser. You may respond.
Yeah, sorry. First of all, I wanted to address the question about S664.
Well, no, actually, if you would just if you could respond to Senator Dela Cruz's question first, and then I'll let you get into 664. Go ahead.
She asked about both of the bills, I believe, 664 and 645, unless I misheard the question.
That's correct. Go ahead. You may proceed.
The question I'm sorry, Chair.
Go ahead. Would you just restate the question, Senator Dela Cruz, just so there's no confusion, and then Ms. Weiser, you can go ahead after Senator restates the question.
Thank you, Chairman. So the question is, how does 645 and 664, how does it restrict abortion access? You had stated that it restricts abortion access, but in fact, it has nothing to do with abortion, those two bills. And then we can talk about the other option if the chair sees fit.
Certainly. Go ahead, Ms. Weiser.
Great. Okay, because I was just going to address both of them, but I'm happy to start with 645. So the issue with 645 is not that, of course, healthcare facilities should be inspected. The issue is, I believe, at least for me, and I'm not a healthcare provider, but line C may conduct unannounced inspections of those licensed healthcare facilities, and that can result in a facility having its license removed. Now, we know that these facilities in many other states are still subjected to this kind of scrutiny that seems designed to place an undue burden that is not placed on other facilities in order to try and catch them out. I have confidence in the healthcare facilities that provide this service, Planned Parenthood, my own OBGYN facility, that they would be able to pass an unexpected visit with flying colors. However, it is still an unfair standard that we should be not applying to these facilities in a way that is directed at trying to catch them out in these moments. Now I can answer the question around 664.
Hold on just 1 second. Hold on 1 second. Senator Dela Cruz has a follow-up. Senator Dela Cruz.
So you had said that you're certain that Planned Parenthood and your OBGYN would pass with flying colors. And no doubt, I agree with you, but we should still have those safeguards in place. And I would also like to point out again, the bill says that the licensed healthcare facilities that are used to perform abortions shall meet the same licensing requirements. We are not placing, this bill does not place additional requirements on abortion facilities. It requires the same level of compliance. And really that was it. Thank you, Chair.
No, that's okay. Thank you. Ms. Weiser, you may respond. Go ahead.
As well as Senator Dela Cruz, thank you for bringing that up, because it does say shall meet the same licensing requirements as other similar healthcare facilities. However, that's line 5. However, similar healthcare facilities is ill-defined. Yet again, this could be utilized to place undue restrictions on these healthcare clinics, such as in many southern states, which require admitting procedures and other things that, again, become an undue licensing burden on these clinics that would legislate them out of existence. Thank you for that. Thank you for that question. Would you like me to answer in response to 664 as well?
Yes, thank you. You can wrap it up with that. Go ahead.
Great. So 664, otherwise known as the Born Alive Infant Protection Act, does actually restrict abortion in, I need to find the line, I am pulling through. Okay. So specifically, line 15, born alive or live birth means the complete expulsion or extraction of an infant from their mother, regardless of the state of gestational development. That after expulsion or extraction, blah, 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 sorry, I don't want to take up all your time by reading it, there shows any evidence of life, including but not limited to breathing, a heartbeat, umbilical cord pulsation, dependent movement of voluntary muscles. Now, keep in mind, a heartbeat, as defined by many of these bills, can be as soon as 18 days. And an expulsion of an 18-day fetus, which according to this line 16, regardless of the state of gestational development, is that fetus still alive at 18 days? That could happen so early in a miscarriage that then this would this bill apply to this as well? Basically, what this is doing is providing, and we all know that there is no way to keep alive an 18-day fetus.
Hold on 1 second. Thank you, Senator Dela Cruz.
That is a stretch, a reach. No one is saying that. First of all, I don't even think it's possible that any doctor could resuscitate an 18-day-old fetus. But what we're talking about is if there's an abortion that is induced and the baby is born alive, every effort will be made to keep that infant alive. Now, perhaps there are some miraculous medical procedures that I don't know about that 18-day-old fetuses can't survive outside the womb. I just have never heard of it. What we're talking about is if it is able to be saved, just like anybody else, if you come to a scene of an accident or if somebody shows up in an emergency room, that we will do everything we can to keep that person alive. It has nothing to do with abortion, and as well as Bill 645. These are extreme examples that are really, they just wouldn't happen. So again, 18-day-old, Sam, I like you. I don't dislike you at all. I think you're a really great person. I honestly mean that. We've had some great conversations. We're just going to disagree on this one.
Thank you, Senator. Are there any other questions?
But if I can just respond to that.
Just very quickly, please.
Whenever we read the bill, what we must do is not look at, not necessarily what the bill intends, which is, always a great thing to look at, but we have to look at what the bill actually says. And the line that I just read says that any stage of gestational development that a fetus is expelled with any signs of those life, which can be as early as 18 days, must be kept alive. And I believe the punishment, if you fail to do this, is pretty strict on behalf of the healthcare provider. Now, I understand what you're saying as the purpose of this bill, but I think it's very important that we look at what the bill actually says. Thank you very much for all of your questions.
Thank you very much. Any questions from any other members of the committee? Senator Weiser.
Hi, yeah, thank you, Sam, for that, for your testimony. And the conversation around 645, this isn't a question for anyone, but just more of a comment, because I think it's worth clarifying. So on 645, with this discussion about whether or not we're setting aside special standards for abortion care facilities or whether they're following the same licensing requirements as other similar healthcare facilities. So I actually went and looked at the statute while we were having this conversation. And what this bill does do is it actually creates a new subsection in the law that is specifically titled Licensed Healthcare Facilities for Abortions. So it is actually creating a carve-out for facilities that provide abortion procedures. And I think that that's really important for this conversation, because when bills like this pass, the next thing that happens is rulemaking from the agencies, which I agree with, because I think our agencies, do a good job. But what this bill is doing is it is taking it away from where these facilities are currently licensed under what subsection. And I'm no expert in healthcare facility regulation, but just by the very legal fact that it's creating a new subsection of law is by definition creating a carve out. And I also believe there's only a handful of facilities that provide this type of care. So really, this legislation 645 is going to be creating a specific set aside standards for essentially Planned Parenthood and the hospitals. And I just think that it's important that that is very clear. And I think that is inappropriate, quite frankly. So thank you.
Thank you, Senator. Senator Dela Cruz, and just briefly, please, then we're going to move on. Thank you. Go ahead, Senator Dela Cruz.
Absolutely, Chair. Thank you so much for that. We're getting stuck here on a little. We're making something of nothing, right? The bill clearly states that it would be meeting the same licensing requirements as other healthcare facilities. There are many hospitals in the state. All of them provide abortions in addition to Planned Parenthood. This bill does not, the point here is the bill does not prohibit abortions. It simply ensures that the facilities that women go to for this very critical care is safe for women, right? We always hear safe and legal. This is safe for women. It's already legal. Let's make sure that it's safe, because in 2019, there still wasn't an inspection done for 10 years of Planned Parenthood. That is egregious. It is not safe for women. We need to ensure yearly inspections, because if McDonald's can be inspected yearly, then certainly, absolute certainty, so should abortion clinics.
Thank you very much, Senator. If anyone wants to continue the dialogue after, feel free to, but we're going to move on to the next bill. Thank you, everyone involved. Strike that, the next bill, the next caller. Our next caller is Jennifer Lima. Good evening, Ms. Lima.
Yes.
Yes, welcome to the committee. You have 3.5 minutes and you may proceed.
Great, thank you. I'd like to thank the chair and the committee for allowing me to testify today in support of S267.
Everyone involved.
Oops, sorry, I thought I muted that.
Next caller. Our next caller is Jennifer. Sorry, if you just shut off your background noise, it'll make it easy. It'll go smooth. Thank you.
Sorry. So again, thank you for allowing me to testify in support today of 267. No one should be denied access to abortion because of how much money they have or the kind of insurance program they use to get their health services. Abortion is health care, and access to health care should not be met with any barriers. Restrictions on Medicaid coverage of abortion target individuals who are already experiencing health disparities and inequities, including poor people, people of color, and young adults. Everybody, no matter how much money they make or who provides their insurance, should be able to access the full range of reproductive health care, including abortion. Abortion is health care, reproductive care is health care, and health care is a human right. A woman's individual needs should determine the practice and availability of care, not politics, personal beliefs, or how much money they have. You know, I discovered I was pregnant at the age of 18 despite using birth control, and I was so grateful to be able to decide whether or not to proceed with the pregnancy. I did. Being an unwed teenage mother was hard, and that's a major understatement. But it would have been so much harder if it hadn't been my choice. You know, and I was lucky I had resources and I had support behind me. I have friends who faced the same decision I did, and they chose differently. I accompanied them to the clinic through a gauntlet of protesters during one of their most difficult times. You know, years later as an adult, I found myself volunteering as an escort for Planned Parenthood doing the exact same thing. I've been yelled at, spit on, physically intimidated, had things thrown at me, and I've seen people on the hardest day of their life being harassed in ways that no one deserves to be. You know, as one of the people who testified earlier today said, nobody takes the decision on how to proceed with a pregnancy lightly. Cost should not be the determining factor in whether or not they decide to proceed with that. Everyone should be able to make their own decisions about pregnancy based on their own unique circumstances and have the resources they need to exercise that decision with autonomy and dignity. You know, our healthcare laws should not be based on people's personal beliefs. They should be about quality of care and preventing health disparities. And that includes getting rid of the bans on healthcare for abortion. So thank you, and I urge you all to pass this bill today.
Thank you very much, Ms. Lima, for your testimony. Any questions? I see no questions at this time.